Hello everyone, let's talk about the examination scheme of CNS. In this tutorial, we'll be only discussing of the examination scheme and the proforma which has to be followed in CNS examination. This module is equally important for a medical examination of any CNS case. It can be used both by the postgraduate as well as the undergraduate students. So if you're looking for just the examination scheme of CNS, you have come to the right point. Now let's just start with the quick review of the CNS scheme of examination. Before we begin, please subscribe to my channel and support my channel so that I can produce more videos like this in future that can help you in CNS examination. Now let's begin. Here you can see the scheme of the neurological examination. We'll begin with the higher functions, which will include the consciousness, the cognitive and the mental state of the patient, followed by the cranial nerves, which we will be systematically looking in from the cranial nerve first to the cranial nerve 12th, followed by the motor examination, the sensory examination, the cerebellar sign, the autonomic dysfunction, the meningeal signs, and the localization of lesion. I'll be making an individual video of each of the scheme of neurological examination as we go ahead. The higher function examination includes the level of consciousness. Firstly, what level of consciousness of patients we are expecting and how to differentiate between a brain dead, a comatose and a vegetative state person. Next, we will talk about the 4-score system followed by the Glasgow Coma Scale, the orientation, the memory, the attention span, the perception, the speech and language problems, the insight and abstract thinking, calculation, individual lobe functions, and finally the release reflex. The cranial nerve examinations will include the optic nerve, olfactory nerve, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, spinal accessory nerve, and hypoglossal nerve. We will be looking at the anatomy and individual testing of each cranial nerves in detail. In motor system, we will be looking at the muscle bulk, the tone of the muscle, how to check the tone of the muscle in an infant, a neonate, and a child. We will be also studying about the powers or the strength of the muscle, the deep tendon reflexes followed by the superficial reflexes, the gait and its abnormalities, and also the abnormal body movements. The sensory system will include a proper sensory levels, light, touch, sensation, pain touch sensation, Romberg's test, pain discrimination, joint and vibration sense, and finally the cortical sensations, which will include 2-point discrimination, tactile localization, graphesthesia, and followed by stereognosis. The cerebellar signs, which will include gait ataxias, dysarrhythmias, dysmetrias, intentional tremors, dysdocokinesias, overshootings, hypotonias, and pendular knees reflexes, and many more. We will talk about it later when I am making a video on cerebellar signs. The autonomic system consists of firstly the symptoms, which will decide if there is an involvement of the autonomic system, followed by a general examination and examination of cardiovascular reflexes. Then the meningeal signs, which will include the neck stiffness, Kernig signs, and Brudinsky sign, which will be included in the next talk. Now, after doing a thorough examination, you will come to a conclusion that the sub-CNS involvement that is there. You will have to differentiate whether it is an upper motor neuron or a lower motor neuron. If an upper motor neuron, then where is the lesion? And if there is a lower motor neuron, exactly where is the lesion? And so on. So, this is the scheme in which you will follow a neurological examination. It will always include the higher functions followed by the localization of lesions. So when doing a central nervous system examination, you will always follow this pattern and this sequence of examination and coming to a specific diagnosis. So if you like this video, please hit the like button, subscribe to my channel, do support me, and let me know in the comments what part of the CNS examination you would want to know first. Keep me posted. Thank you.